Welcome students. Today we can study about extraocular muscles. So extraocular muscles, they are the muscles which are seen inside the orbit. So here we can see this is the orbit. This is bony orbit. So this one. So this is our bony orbit. So inside the bony orbit we can see this is our eyeball. So outside the eyeball some muscles can be seen. So these are the extraocular muscles. Extraocular muscles. Okay. And here this is the eyeball. You can see this white color portion. This is eyeball. And the extraocular muscles are classified into voluntary muscles and involuntary muscles. Okay. These extraocular muscles helps in the movement of this eyeball. Movement of the eyeball. Okay. So the extraocular muscles are classified into voluntary muscles and involuntary muscles. Okay. The involuntary muscles are the superior tarsal muscle. Superior tarsal. So this is the tarsal plate. Here we can see a cartilaginous piece inside our eyelid. This is the eyelid. So inside the eyelid we can see a cartilage piece. So this is known as tarsal plate. Here also inferior eyelid, inferior eyelid we can see also inferior tarsal plate. Okay. So towards the tarsal plate we can see small muscles. They are the involuntary muscles. So superiorly there will be superior tarsal muscle and inferiorly there is inferior tarsal muscle. And the third muscle is the orbitalis muscle, which is seen bridges across the inferior orbital fissure. Inferior orbital fissure. So these are the three involuntary muscles: superior tarsal muscle, inferior tarsal muscle, and the orbitalis muscle. So these three are the involuntary muscles. Then coming to the voluntary muscles are of two types. One is rectus muscles, then oblique muscles, and one levator palpebrae superioris muscle. So four rectus muscles, then two oblique muscles, and there is a levator palpebrae superioris muscle. First we can study about the superior oblique muscle. Levator palpebrae superioris muscle. Okay. So this is the levator palpebrae superioris muscle. You can see it is going towards the palpebrae. Okay. So this is levator palpebrae superioris muscle. Okay. This is the muscle origin from the lesser wing, orbital surface of the lesser wing. Here comes the lesser wing of sphenoid. This is the body of the sphenoid. So here this is the lesser wing of sphenoid. It origin from the orbital surface of the lesser wing of sphenoid. Then it passes anteriorly. Tendon passes anteriorly, and when it reaches the anterior part of the orbit, the tendon will split. Tendon of the levator will split into superior or voluntary part, then inferior or involuntary lamellae. So there will be two lamellae. Superiorly there is a voluntary part, and inferiorly there will be involuntary part. The superior lamellae is inserted into the anterior surface of the superior tarsal. This is the superior tarsus. So the superior part inserted into the anterior surface of the superior tarsus and into the skin of the upper eyelid. Here we can see, and to the skin of the upper eyelid. So the superior part inserted into the anterior surface of the superior tarsus and also into the skin of the over the upper eyelid, skin of the upper eyelid. Okay, the inferior lamellae, that is a smooth part or involuntary part that is inserted into the upper margin of the superior rectus. Inserted into the upper margin. This is upper margin. So it is inserted into the upper margin of the superior tarsus. So this is the involuntary part, which is known as superior tarsal muscle, superior tarsal. Okay, so this part is the voluntary part, voluntary muscle. So it is the levator palpebrae superioris. Origin from the lesser wing of sphenoid, inserted into the tarsal plate and to the skin. So it is levator palpebrae superioris muscle. Then next is four rectus muscles. There are four recti, that is straight muscles. So there are four rectus muscles can be seen. They are superiorly, there will be superior rectus. So this is superior rectus muscle. Inferiorly there will be inferior rectus, then laterally there is lateral rectus, and medially there will be medial rectus. So 4 rectus muscles can be seen: superior rectus, inferior rectus, medial rectus, and lateral rectus. So these rectus muscles. Then oblique muscles. There are 2 oblique muscles. Here we can see there is a superior oblique muscle. This is superior oblique, and here one more inferior oblique muscle. Inferior oblique. So 2 oblique muscles. Then coming to the origin of the rectus muscles. So rectus muscles origin from a common tendinous ring. Here we can see a common tendinous ring. So all the rectus muscles origin from the corresponding part. Superior rectus origin from the superior part of the ring, inferior rectus origin from the inferior part of the common tendinous ring, and medial rectus from the medial side, and lateral rectus from the lateral aspect of the common tendinous ring. Okay, so this is the common tendinous ring, or this one. So it origin from the common tendinous ring and inserted into the sclera. This is our sclera. Okay. Inserted into the sclera in front of the equator. So corresponding part of the sclera in front of the equator. So here comes the equator of the eyeball. So in front of the equator, in the corresponding part. So superior rectus muscle will inserted into the superior aspect of the sclera, then inferior rectus inserted into the inferior aspect, then medial rectus into the medial side, and lateral rectus into the lateral aspect of the sclera in front of the equator. That is the insertion of the rectus muscles. Superior rectus, inferior rectus, medial and lateral rectus muscles. Then superior oblique muscle. Superior oblique muscle arises from the undersurface or orbital surface of the lesser wing of sphenoid. Lesser wing of sphenoid, supromedial to the optic canal. So here comes the optic canal. So supromedial to the optic canal, it arises from the lesser wing of the sphenoid, superior oblique muscle. Then inferior oblique muscle origin from the orbital surface of the maxilla. This is the maxilla. Here we can see this is the maxilla. So origin from the orbital surface of the maxilla, lateral to the lacrimal groove. Here one groove is there, that is known as lacrimal groove. So lateral to the lacrimal groove, the inferior oblique muscle will arise, and insertion of the superior oblique muscle. You can see, so this is the superior oblique muscle, this one. So superior oblique arises from the lesser wing, passes anteriorly, fibers passes anteriorly, and when it passes towards the fibers passes anteriorly and towards medial side. And towards the medial aspect, we can see there is a fibrous pulley. So this is the fibrous pulley. So it passes through the fibrous pulley, and the fibers will run backward and laterally. Then it again runs backward and laterally and get inserted into the sclera behind the equator. Inserted in the sclera behind the equator. So this is the superior oblique muscle. Superior oblique. So inferior oblique also, after arises from the maxilla, fibers will passes laterally and backward and upward and below the inferior rectus. Passes below the this is inferior rectus muscles. So passes below the inferior rectus muscle and get inserted into the sclera behind the equator near to the insertion of the superior oblique muscle. So this is the inferior oblique muscle. So these are the 2 oblique muscles. One is superior oblique and this is the inferior oblique muscle. Inferior oblique, superior oblique muscle and inferior oblique muscle, both inserted in the sclera behind the equator. So recti muscles will be inserted in the sclera in front of the equator. Okay. All are inserted in the sclera only. Sclera. Okay. So that is the origin and insertion of the extraocular muscles. Then coming to the nerve supply of the muscles, the all the muscles except superior oblique and lateral rectus are supplied by oculomotor nerve, that is third cranial nerve. Okay. So superior oblique muscle, it is supplied by the fourth cranial nerve, that is trochlear nerve. So here the superior oblique is having a trochlea, so it is supplied by the trochlear nerve. Okay. Superior oblique nerve supply is the trochlear nerve. Then lateral rectus. Lateral rectus is supplied by sixth cranial nerve, that is abducens nerve. Abducens nerve. Okay. And all the other muscles, they are supplied by the third cranial nerve, that is oculomotor nerve. Okay. So that is the nerve supply of the extraocular muscle. All the muscles except superior oblique and lateral rectus recti are supplied by oculomotor nerve. Superior oblique is supplied by the trochlear nerve, and lateral rectus is supplied by the abducens nerve. And coming to the actions of the extraocular muscles, here we can see this is the elevation. So elevation of the eyeball. So elevation is by the superior recti muscles. Superior recti elevation. Okay. That is movement of the eyeball towards the upper part. Upper superior movement. That is the elevation. This by the superior recti muscle. And here we can see this is the depression. Depression. Yeah, this is by the inferior recti muscle. Then so this movement, here we can see this movement that is moving towards the upward and laterally. So this movement, that is by the inferior oblique muscle. So this is the lateral rectus. Lateral rectus helps in the abduction of, that is eyeball towards the lateral side. That is by the lateral rectus. So this is known as abduction. So this movement, this is known as adduction. So this is the movement of eyeball towards the medial aspect. This is known as adduction. So adduction is by the medial rectus. Abduction is by the lateral rectus. That is movement of the eyeball towards the lateral side. So this is known as abduction. This is adduction. So abduction is by lateral rectus and adduction is by the medial rectus. Okay. Then other than this elevation, depression, adduction and abduction, other two rotatory movements are there for the eyeball. Okay. That is known as intorsion and extorsion. So intorsion is the medial movement. That is, we can see this diagrammatic picture. So this is the 12 o'clock position. So this is our eyeball, right eye. Okay. So in this right eye, we can see there will be two rotatory movements that we will be calculated in the defined in the terms of movement of the clock. Okay. Then we can see if the eyeball moves towards this direction, that is from the clockwise direction, okay, from 12, 1, 2, 3, that is to clockwise direction. So this movement, that is movement towards medially, okay, towards the medial side and inferiorly like this. So this movement, this rotatory movement is known as intorsion, and if it is going like anti-clockwise like this is known as extorsion. Okay. So this intorsion is by the superior recti muscle and also by the superior oblique muscle. So both will help in this movement, this rotation. Okay. So superior rectus and superior oblique muscle helps in the intorsion. Intorsion. This is the word intorsion. Okay. So movement towards the clockwise direction like this. That is the intorsion. Okay. Then opposite direction, this one, this rotatory movement, that is anti-clockwise movement, this is known as extorsion. Extorsion. This is extorsion, and it is produced by the inferior oblique muscle and also by the inferior rectus muscle. This one, this movement. So this is the extorsion movement. This is the intorsion. So two rotatory movements here, intorsion and extorsion. So these are the actions and these are the movements and the muscle causing movements on the extraocular muscles. Okay. So superior rectus helps in the elevation and also intorsion. Then inferior rectus helps in the depression and also extorsion. Then superior oblique helps in the depression and it also helps in the abduction and also helps in the intorsion. Superior oblique helps in depression, abduction and intorsion. Okay. Inferior oblique helps in the extorsion, elevation and abduction. Both oblique muscle helps in the abduction. So we'll see the movement. So this movement, so this is by them, this is known as intorsion, sorry, extorsion. So this is by the superior oblique muscle and also inferior oblique plus superior rectus muscle. This part here. Okay, both superior rectus and the inferior oblique muscle of each side helps in the extorsion. Okay, then this is the superior oblique. Here we can see superior oblique helps in the abduction, depression and also extorsion, intorsion. Okay, so this is the superior oblique muscle. Action of the superior oblique. Okay. This is the combined action of the inferior rectus and the superior oblique muscle. So these are the muscle and the movements. Here superior oblique muscle helps in depression, abduction and intorsion. Inferior oblique muscle helps in elevation, abduction and extorsion. Then inferior rectus muscle helps in depression, adduction, inferior rectus, adduction and extorsion. Yeah. Superior rectus muscle helps in elevation, adduction and intorsion. So adduction is by the superior rectus and inferior rectus. Adduction. Yeah. Abduction by the superior oblique and inferior oblique muscle. Abduction along with the lateral and medial recti. Okay. Helps in the then medial rectus only helps in adduction and lateral rectus helps in the abduction. So these are the movements of the eyeball and muscles, helps in the movements. And applied anatomy of the extraocular muscles. So paralysis of any of the muscles can cause squint or strabismus, and most commonly we can see there will be concomitant squint or congenital squint is there, and paralytic squint is there. So congenital squint, there will be by birth itself there will be some paralysis of the muscles. Because of that but there won't be any diplopia, that is double vision won't be there in the congenital squint. But in case of paralytic squint, that is caused due to the paralysis or injury to any nerves which supplies the extraocular muscles. So if there is any injury to the nerve which supplies the extraocular muscles, okay, that will result in the paralysis of the muscles, and there will be restriction of movements. Okay. And in case of medial squint, see this is the medial squint. Here we can see the eyeball is seen towards the medial side. So this medial squint is because of the paralysis of the lateral rectus muscle, lateral rectus, because this eyeball cannot move towards the lateral side. Okay, it is seen towards the medial side. So paralysis of the lateral rectus muscle, that means there will be injury to the abducens nerve. So the abducens nerve will supply the lateral rectum. Okay. So due to the paralysis or injury to that abducens nerve result in the medial squint. Okay. And same like this, there will be lateral squint, that means this eyeball can be seen towards the lateral side. In the lateral squint, that means the eyeball cannot move medially, so that will be due to the paralysis of medial rectum. the medial rectus muscle. Okay, that is oculomotor. So that is the medial squint and the lateral squint. Then there will be nystagmus. Nystagmus is the involuntary contraction of the muscle eye. Involuntary contraction of the eye due to incoordination of the ocular muscles, extraocular muscles. That is known as nystagmus. Abnormal contraction of the abnormal involuntary movements of the eyeball. That is known as nystagmus. So these two are the applied aspect of the extraocular muscles.